Hi there. Welcome to Anonymity 1D. My name is Dave. I have been living with type 1 diabetes for many years.
And my name is Dr. Brian Snyder. I am Dave's endocrinologist. In this video, we go over what is active insulin time and its role in diabetes management. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team. Thank you. Hi, Dave. How have you been? How did it go with watching your insulin on board?
It was very helpful. I am slowly beginning to understand how to make decisions before exercise based on my insulin on board. It is sometimes frustrating when I want to give more insulin for high sugar correction, but it won't let me. Is there a way to change the insulin on board?
There is no way to change the insulin on board directly, but you can change what's called active insulin time, which is basically the amount of time that the insulin is active. There are two different concepts here that you need to understand. Duration of action. This refers to the amount of time that insulin can be measured in the blood. Active insulin time. This refers to the time over which insulin can lower the blood sugar. If a dose of rapid-acting insulin is given at this point, insulin is measurable in the blood around 45 minutes later and peaks at about an hour. It then stays in the blood for 3 to 5 hours. This is called duration of action and shown by the line between C and D. On the other hand, the insulin starts lowering blood sugar a little later than when the insulin is measurable in the blood. That effect wears off over the next few hours. So the effect of insulin starts after and stops before the insulin is measurable. This is called active insulin time and is shown here as the line between A and B. Pumps use active insulin time. If you want to be able to bolus more, then you can shorten the active insulin time, for example, from 4 to 3 hours. Then the pump looks back only 3 hours and not 4, allowing you to dose more.
Can I decrease it down to 2 hours?
You can, but then you run into the risk of stacking insulin. Remember this graph that we went over last time? Here you can see that even though its effect is waning, insulin is still active for up to 5 hours. If you have an active insulin time of 2 hours, the previous dose still has about 60% effect. So, too many insulin doses back-to-back can add up and cause low blood sugars, which is called insulin stacking. It is very common to think insulin works faster than what it usually does, especially if you have noticed that sometimes you give a dose of insulin and then the blood sugar drops soon after. This is most likely not due to the most recent dose, but an accumulation of the previous doses, basically the insulin on board.
I have noticed that too. I thought my carb ratio was too strong and started adjusting that. I did not realize that the insulin on board may be playing a role.
Exactly. Similarly, in the situation that you mentioned where you wanted to give a stronger high sugar correction and the pump would not let you, you may have to go back to why the blood sugar was high in the first place. Your carb ratio or high sugar correction may need to be stronger.
Is there anything that can affect the active insulin time?
Yes. The type of bolus, as in regular, combination, or extended bolus, affects active insulin time. How long the infusion set has been in has an effect. The site location matters too. For example, duration of action is longer in the thighs than abdomen. Sites near exercising muscles hasten insulin action. There are many more factors like insulin resistance, temperature, and any medications that you might be on.
So, when should I adjust the active insulin time?
An active insulin time of 4 to 5 hours is closer to how long rapid-acting insulin in the pump works. Instead of shortening the active insulin time, you should first try to adjust your basal rate, carb ratios, or correction factors. If your active insulin time is 3 hours or less, that can lead to insulin stacking because close to half a bolus dose given 3 hours ago is still active. If you still feel you need the active insulin time needs to be changed, then you can try to shorten it, but don't go down to less than 3 hours.
Dr. Snyder, thank you. This was very helpful. Between looking at insulin on board and adjusting active insulin time if needed, I now have another tool that I can use to manage my diabetes with my insulin pump.
No problem. We hope this gave you a better understanding of active insulin time. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel. Thank you.